Ned Lamont so far has held one political position, which is governor of Connecticut. He got elected in 2018, reelected in 2022. So I'm going to give you a list of the accomplishments that he has done in that state. And again, I'm going to go through all the Democratic governors in the country. Why am I doing this? Because this stuff is exhausting and I'm inching closer and closer to exiting politics. And, if I do happen to exit, then at the end of the day, I can at least say, hey, I gave people the information. So I talked about Jared Polis. I talked about Katie Hobbs, Gavin Newsom. Who's the other one I covered? Guys, I can't even think right now. Who else was it? There's plenty more that I'm going to cover. Like I said, I can't wait to get to Gretchen Whitmer, Tim Walz, a few others. So here's the deal. Governor Ned Lamont serving as Connecticut's governor from 2018. Okay, let me skip that. So on healthcare, expansion of health insurance. The 2021 state budget expanded Husky, a health insurance extending coverage to an additional 40,000 residents, paid family leave and paid medical leave. In June of 2019, he signed legislation establishing a comprehensive family and medical leave program. Effective from 2022, it allows workers up to 12 weeks of paid leave for personal or family health issues, funded by a 0.5% payroll tax on employees. Insulin cost cap. He implemented a cap on insulin copays at $25 per month and insulin-related supplies at $100 per month to make diabetes management more affordable. Now, let me stop right there. This is the part where, for some odd reason, I have no patience for this stuff. I have no patience for this. For some reason, I know conservatives and right-wingers and Republicans are looking at that saying, that's communism. Why? Or that's fascism or socialism or whatever type of ism we can think of. We can make up our own word for it. It's ridiculousnessism. Why? Why is it? Guys, can somebody please just provide a legitimate, just give me a proper, legitimate argument for why somebody would be against the idea of insulin copays being capped at $25 a month? President Biden and Vice President Harris did that. I think they capped it at $35 a month. Governor Newsom did $30 a month in his state. So, guys, insulin is expensive for a lot of people. I've seen a lot of comments online. People are paying hundreds of dollars. They're capping it at this rate that saves people money. So, guys, I don't see a problem with that. I don't get that. I don't get it. But hey, if you just put it in the comment section. Put it in the comment section. You give me a legitimate argument. On education, debt-free community college. He introduced a program offering debt-free community college for full-time students, enhancing access to higher education. Okay, so to all you anti-Democrat lefties out there, just so you know, he did that. Tim Walz did that in Minnesota. Public free college for anyone who makes under 80K. Just throwing it out there. Increased education funding. The 2019 budget increased funding for education and workforce development, maintaining municipal aid to provide stability for local budgets. Wages and workers' rights. Minimum wage increase. In May of 2019, he signed a bill raising the state minimum wage to $15 an hour by 2023, aiming to improve living standards for low-income workers. Paid sick leave expansion. A bill was signed expanding mandatory paid sick leave to smaller companies, requiring an hour of time off for every 30 hours worked. Okay, that's good. Democrats need to embrace that. Support for workers, unions, and collective bargaining. Workforce development investments. Ned Lamont's administration has made significant investments in workforce training, including the largest in the state's history, to support better paying jobs and economic growth. Now, to be fair, I don't see anything here about collective bargaining, so he may not have done that. What was that other one? I don't see anything here regarding unions, so I don't know. He probably didn't do much on that either, just to be fair. Student meals. Summer program funding. He invested $11 million in funding for summer programs supporting student nutrition and engagement during school breaks. Economic relief and stimulus measures. Tax relief initiatives. He signed the largest tax relief package in state history, $660 million, providing immediate relief through measures like a gas tax holiday, capped car tax, and increased child tax rebate up to $250 per child. Earned Income Tax Credit, EITC, increased the EITC, providing an additional 42 million in relief to about 185,000 households, offering roughly an extra $300 each. Medical debt, healthcare affordability measures. Through various initiatives, including the Covered Connecticut program, his administration has worked to provide no cost healthcare to nearly 40,000 adults, aiming to reduce medical debt among residents. These actions reflect. Okay, hold on, let me go down. Break down how he eliminated or reduced medical debt in his state. Expansion of healthcare coverage. Okay, they already covered the Husky one there, the impact. So, the impact of the Husky Health Program, it prevents debt accumulation by reducing out of pocket healthcare costs for tens of thousands of residents. Covered Connecticut program provides no cost health insurance for eligible low income individuals and families. The program covers medical expenses, dental, and vision services, along with premium and out of pocket cost. Key benefits: it eliminates premiums, copays, and deductibles, which is what a lot of you anti Democrat lefties, that's what you've been pushing for. That's what he did. Directly reduces existing medical debt by offering comprehensive health care coverage at no cost. Focused on residents earning up to 175% of the federal poverty level who are enrolled in the Affordable Care Act's insurance marketplace. And then they repeated the insulin thing. They already talked about that. Hospital billing and transparency reform. His administration worked on increasing transparency in hospital billing and improving consumer protection laws. This includes requiring clearer explanations of bills, preventing surprise medical billing, creating limits on aggressive debt collection practices, and impact, it reduces the stress and financial burden of unexpected bills, preventing medical debt from spiraling. Relief for existing medical debt. Connecticut joined other states in leveraging federal funds and state programs to buy out and forgive existing medical debt, especially for low-income residents. The state of Arizona did that. Shout out to Katie Hobbs for doing that. These efforts include partnering with organizations like RIP Medical Debt, which purchases medical debt at pennies on the dollar and forgives it. Targeting relief for families with incomes less than 200% of the federal poverty line. Enhanced consumer protections against medical debt. The governor strengthened laws to protect residents from predatory debt collection tactics, limiting interest rates on unpaid medical debt, restricting hospital lawsuits against low-income patients, prohibiting wage garnishment for smaller medical debts. Healthcare Affordability Task Force. He convened a task force to tackle rising healthcare costs with a focus on reducing premiums and out-of-pocket expenses. I know they're repeating some of this here. Finding long-term solutions for systemic affordability issues. Here's the summary of the impact. The governor's strategies have combined immediate relief such as debt forgiveness and cost caps with systemic reforms like coverage expansion and billing transparency. These actions have prevented new medical debt from accumulating, reduced or eliminated existing medical debt for thousands of Connecticut residents, offer sustainable, affordable healthcare solutions to lessen financial burdens long term. By addressing both the causes and the consequences of medical debt, Ned Lamont's initiatives have positioned Connecticut as a leader in combating this pervasive issue. So that's that. So just to give that out to you. So that's why the state made a good decision by electing him and re-electing him, which, more than likely had been the same case if it was almost any other Democrat elected to that spot. But again, just me giving you the information right here. If you're a Democrat, liberal, left-winger, and you're watching this, share this, put it out there, let them know, hey, Democrats are doing things for people. And any right-winger, conservative, or Republican watching this, I think I know what to expect out of you. They're going to sit here and say, oh, this is lies, fake news, you're a DNC puppet, somebody's paying you to say this. Just all that BS, all that nonsense. So there's that, and I'm going to get to other governors. I'm going to talk about John Carney. I'm going to talk about Laura Kelly, Kathy Hochul, a number of them coming up. So stay tuned, like, comment, subscribe to the YouTube, follow me on Facebook, Twitter, Instagram, TikTok. Until next time.